Hello and welcome to GovMates Tech Talks. I am Meg Kearns and I am here today with the gentleman from Orthoforge who are going to tell us a little bit about what they do and how their technology is making waves in the industry. So first question I'm going to jump right into, Brent, is who are you and what makes you an expert in your industry?
Well, Meg, first of all, I want to thank you for letting us join you and being recorded to give this talk. But I have over 30 years experience as a technology innovator and entrepreneur and executive in industry. My experience is a complementary mix. It's really a balance between industry and academia. And what I'm most proud of and what makes me an expert is that I'd estimate about over 80% of all the programs that I've worked on, I've led, I've launched, they're all in the field and operational systems today. So we solve real world problems at Orthoforge.
That's awesome. You have the experience necessary and the stuff to back it up that says, hey, we've done this and we're going to continue to do this. So I have done a little bit of reading, but I want to hear it from your mouth specifically. Can you give us the 60-second quick hit? What is Orthoforge and who does it serve?
Sure. Orthoforge has a patented platform technology. We continuously and remotely monitor bones, bone fractures. It could be a trauma of any kind, and we don't use any harmful radiation. So the technology sits on the skin, and what we do is we apply our proprietary artificial intelligence and machine learning algorithms that we've been in development and testing for a little over 10 years now. So this algorithm, it uniquely characterizes each patient and what's unique about your fractures. So we all heal slightly differently, which is important to understand. And especially if you have another comorbidity, as we all hear about nowadays. But whether you're a smoker, you're a diabetic, otherwise, that affects how well you heal your bones. And so the earlier that a clinician can get insight to how well you're healing, the more quickly they can make changes in your treatment plan. So while we're a pre-revenue company, we're poised in 2022 to launch our pilot human clinical trials. It's a pretty exciting time.
It's just very interesting to see that as a person myself who has several broken bones in her past, the one and done is kind of not the way that this process works, correct? Because usually when a bone is broken, if you go in, you're like, oh, yeah, you fractured a finger, and then they put a cast on it, and then they say, okay, you're done. That's completely different from the way that you all are using this, correct?
Yeah, that's great insight. Exactly right. So instead of the one and done, like you say, this technology could be included within your cast, or it could be something that could be periodically applied toward the fracture site so that you can characterize it. And so what's really cool about this, Meg, is someone who's had fractures before. In the past, when the clinician wanted to check on the progress, you'd have to go to the office, you'd sit in the waiting room, then you go into the room where you're going to meet with this clinician. He'll sometimes take your cast off, feel it, send you for some more x-rays, and then you repeat and rinse, 4 or 5 times.
Yeah, it's a whole day process.
Time consuming. Yeah, it's time consuming. It's harmful radiation. And, if you've got children, dual income, it's very difficult sometimes to get all that stuff done efficiently.
It definitely is. So this kind of takes all of that prep work and continuation out of the process is what you're saying.
Right. So wirelessly now through the cloud, our software then analyzes these signals. Now we're using ultrasound energy, not ultrasound imaging. I want to make sure everyone's clear on that. And then the algorithms can process it, and then the clinician or a clinician's assistant, a nurse practitioner, or they can look at the data and they can use this as remotely to determine how well you're healing. So you don't even have to go into the office. And what's unique as well, this is real exciting, is that with x-rays, they take orthogonal x-rays, but sometimes the x-rays are not often that very clear. But in our case, with our technology, we've demonstrated on live animals that we can monitor and identify asymmetric healing. So not all bones heal evenly at the same rate.
Right.
So you may just have some healing on the anterior side, but the posterior side, you may not have any healing at all, but the x-rays won't illustrate that.
So you can actually see that and change the way that you're being cared for based upon the information that you're getting.
Exactly right.
This has, just from my limited experience with the DoD and things like that, this has some really great possibilities for those in the field, as well as, those who are a little bit more remote. Hopefully getting back to where they need to be is going to be faster because they can see exactly what's happening, how it needs to be healed, what needs to be changed, and those sorts of things that don't always have the time necessary to go in, cast off, do a whole process. So this seems like it has a
Hmm.
really good opportunity to be applied elsewhere, especially for the government customer, which kind of takes us to a question that I have about the problems or the challenges that Orthoforge is helping to solve for the government or the industry.
You raise a very important question, and we're very aware of that. We're working with several organizations to try to get this technology in the field for our soldiers, our men and women that are out there today, but also our first responders, those that are driving the ambulances and the other emergency vehicles. This technology is portable, so you don't need to carry a hefty old X-ray machine out in the field. And of course, you can't.
Right.
Working very closely with colleagues in the DoD to make sure we get this to them immediately, because that's the biggest challenge, as you know, is you want to evaluate the person, the wounded soldier, the wounded civilian that might be in a car wreck or an accident or a sporting accident. You want to get them assessed immediately as soon as possible so that you can take care and do the right thing the first time out. The bottom line, though, is what we're doing is improved outcomes. Our number one goal, and that's true of everyone working in the medical device or in the healthcare industry today. We just want to get the patients healed as quickly as possible. Another key important thing, though, is the FDA has released a white paper on trying to reduce radiation exposure, especially to our young children today. So we don't use any X-rays. So this technology is not a diagnostic technology or a treatment technology. It's an adjunct to the current technology. So it won't eliminate, we're not claiming it eliminates the need for X-rays. X-rays are going to be very important, as you know, but it reduces the need for how many we have. It also gives you access to clinicians, as we all know, as we've gone through this pandemic, that there's a lot more remote health care. And this is just another tool that parents can use, soldiers can use, clinicians can use to monitor the patients remotely. And obviously, ultimately, this leads to reduced costs in healthcare.
There's a lot of things that can be done with this, and I'm really excited for that to kind of like be seen, especially come 2022 for you all. So what is the most impactful part or most impactful solution that you all have developed thus far that kind of meets some of the needs of all of these different groups? Are there any stories or experiences or examples that you can provide that will just kind of tell us a little bit more about that?
There's so many, but let me just tell you one because we have a limited amount of time. But when my co-founder and I were doing our live animal trials, he flew out to Australia where this is being done by an independent lab. The experience of actually putting these on a living patient is very different than doing it in the laboratory. But the most exciting thing is also you start looking at the data and you have, in this case, there were two sheep and we did bicortical osteotomies on them on the right rear femur, but two identical sheep in the same situation and how vastly different their bones were healing. It was remarkable, and I think that's one of the biggest impactful things we can see, because you think of your bones they're basically they're living tissue, but they're very rigid, and we think everything is just going to heal over like you're curing concrete, but it's vastly different than that. It's a very complex biological process that goes on. And now for the first time, we're giving clinicians insight to what's going on without harmful radiation.
That's amazing. I was so worried that when you said Australia that you were going to tell me it was like two kangaroos or something. And I was like, yes, that does sound like it would be different. I think it's very interesting that you can see just basically data alone that even though same species, same, probably close to same age, so that sort of thing, but the vast difference in the way that the body heals because of either those comorbidities or just by being different animals in general, that's going to make the difference in how people are seen. And when you kind of transfer that technology to the human, how that's going to make a change for everybody in the industry, from patient all the way up to the doctors and so on. And it probably changes the way that surgery is done too, I would assume.
You raised a very important question, or point that I didn't raise before, and that was that whether you're just getting a simple cast and no surgery is needed, or you do require surgery and you have to use what's called an intramedullary nail, goes up that canal inside the bone where the bone marrow is, or if you have to use plates and screws. Our technology works just as well with plates and screws or intramedullary nails. But most importantly, there's a lot of technologies out there being developed today, but ours does not have to be implanted in the body. So that's the most important thing. You can just put it on there, and it's an analogy, but like your smartwatch, right? You almost can just put it on and it'll monitor the healing for you.
Just much less invasive instead of something that you're inserting inside the body.
Mm-hmm.
That's amazing. Another thing that I just kind of wanted to ask as we roll things up here, what challenge do you see facing the industry today that needs immediate solutions in your field?
We need improved outcomes. We need to stop exposing people to harmful radiation if there's alternatives out there. We got to provide access to clinicians at all levels. And finally, it's all around cost. As we all know, we talk about how our healthcare costs are growing and growing and growing, and how can we be smarter to deploy those solutions to the population, but also make it more accessible and less costly.
Yep, there you go. Less cost, improved solutions. We like both of those things. All of those things are
Yes,
good.
we do.
Are there any final thoughts or things that you wanted to share with our audience, kind of let them know what's coming or what they need to pay attention to as it comes to Orthoforge and what you all are doing in the industry?
As far as Orthoforge goes, like I said, this is a very exciting year. Like you make a joke in the med device industry, you're going to become an overnight success in 10 years. We're happy that it takes that long. The FDA has a lot of challenges, and we want them to keep keeping our patients safe and keeping the population safe. But yeah, it's going to be a very exciting year. We're looking, like I said, to our first human clinical trials. We've got tons of experimental benchtop laboratory, but also live animal data. And so this is going to be the first human data. So it's an exciting time at Orthoforge.
Thank you so much for being part of Tech Talks today. And we look forward to 2022 for you all.
Very good. Take care. Have a great year.